So we're ready for the holidays, or are we? Do you want to look better, look slimmer, more well-rested during this hectic holiday season? Well, Dr. Darm has the answer. It's called Lipolift. We welcome from aesthetic medicine, Dr. Jerry Darm, along with patient Gretchen Baker. Good to have you both with us. So this is a procedure that will melt away the fat.
Absolutely.
So we can fit into those tighter jeans if we want to.
Absolutely. It's a laser. It goes underneath the skin, melts the fat. The fat is sucked out. A couple days of downtime, and you're back at it, back to work.
When the fat is sucked out, how invasive is that?
Well, just minimally. It's a very small cannula, about the size of a straw.
And it just takes out, and that fat does not come back?
No, no. Shouldn't come back.
So Gretchen, let's take a look at your before and afters, and maybe have Dr. Darm tell us about the before and afters here.
So you can do your tummy, you can do your thighs. In Gretchen's case, she did her tummy, her thighs, and her the love handles as well. And so you can see that significant, well, reshaping and resizing here, basically.
So Gretchen, what's been the difference for you?
Oh, well, one of the difference for me is just feeling better, feeling more confident. Also, like I said, and like Dr. Darm said, very little downtime. I basically went in, had my 2 days off, you know, like my normal 2 days scheduled off before I bought my bar, and then just went back to work. And
physically, what do you see? I mean, are you able to get into a smaller size pair of pants, or how are things fitting better?
Things are fitting better. I lost 2 pant sizes.
Oh, that's great.
You know, so
wow.
Just by doing the procedure, the reason I went in to see Dr. Darm is I saw something on his on the internet, and it intrigued me because it was so non-invasive, and it also was. You know, it was just one of those things. I just wanted to get rid of the, you know, like the muffin top.
Right.
Yeah,
right.
I understand. You know, a lot
that.
of people. Yeah. Someone once said, if you're gonna have muffin top, make it blueberry. But everyone loves it. But now, I would assume for a lot of people, when they have this procedure, they've tried diet, they've tried exercise, but we're talking parts of the body that it's hard to get those places sculpted
That
to
last
the shape
little
you
bit.
want.
So many people, they exercise, they diet, and they just have that little bit left, basically. And so, you know, the chin, for example.
Yeah, you always bring that up. But true. And so in just a short period of time, you can have these results, and they're long-lasting?
They're long-lasting. You're killing the fat cells. The fat's not going to come back in that area. And so it's really a very, very long-term, minimally invasive procedure. And
so Gretchen, was there any pain involved?
There was discomfort. I mean,
Right.
I wouldn't call it excruciating pain. I would call it some minimal discomfort for
Sure.
a couple of days.
I'm going to guess it didn't hurt any more than a vigorous workout.
Right, or a tight pair of
What are your
Spanx.
friends saying to you now?
As time goes on, it's more noticeable.
Yeah.
There's like, oh, I'm starting to see some curves there, you know, as time goes on, because it's a process. I mean, I didn't just go walking out of his office, go, oh yeah, you know, you look fantastic. I mean, it was a process, and one of the great things about going to Dr. Darm's office was the fact that those expectations were set. It wasn't like, okay, well, I see here you're a 48, now you're going to go walking out of size 2.
Right.
Yeah.
That, you know, there was no unrealistic expectations. I mean, and Dr. Darm and his entire staff were just fantastic.
And you look better, you feel great. That's what it's all about. If you'd like to find out more about aesthetic medicine, Dr. Darm, you can find them. We'll have a link on our website at katu.com, or give them a call, 503-697-9777. And good to have you both in today. Thanks for sharing that story. We appreciate it.
Well, thank you. Thanks for having me.
Thanks so much.
From your